held remotely will require roll call votes for all action items. And to streamline, we've combined the action items into one combined motion, so only one roll call vote for action items will be needed during the meeting, and we'll do that at the end. Please note that meetings of the Cook County Health Board and its committees will be held remotely until otherwise noticed due to the determination that a public health emergency exists, which we certainly know. We're going to start with the roll call, so I'd like to call the meeting in order. Madam Secretary, can you please call the roll?
Director Garza is absent. Director Prendergast?
Present.
Director Story?
Present.
Chair Kim?
Present.
And for the record, those directors also present. Director Harrington?
Present.
And Director Ketting.
Present.
You have a quorum.
Great, thank you. I just want to mention that our next regular meeting of the Quality and Patient Safety Committee meeting is scheduled for Friday, December 16th. And this meeting will be held at 9 a.m., so a little earlier than our usual meeting. The next item on the agenda is a public testimony, and I want to ask Madam Secretary if anyone is registered to provide a virtual oral testimony or submitted written testimony to be included in the record. Madam Secretary?
We did not receive any registrations to provide testimony or written testimony.
Okay, thank you. The third item on our agenda is report on quality and patient safety matters. And I just want to remind us all that no action items are needed for this area of our agenda. This is really only informational. So I'd like to invite Dr. Eric Mikiadis, our Chief Quality Officer, to present information on the HRO dashboard. Dr. Mikiadis.
Good morning, everyone. Eric Mikiadis here. Good morning. Thank you, Chair Kim. So let's get the.
Sorry, Mikiadis.
Oh, there's no worries at all.
Hold on one second. Here we go. All right.
Hey, next slide. Thank you very much. So we're going to start, as always, with our 30-day readmission. So this is all unplanned all-cause readmission to Stroger Hospital. We did see a slight increase from 8.3 to 9.1 on overall rates, but we're still performing better than target. Our year-to-date through July for 30-day unplanned all-cause readmission remains, or the average is at 9.77. The readmission team is continuing to focus on heart failure readmissions, and I'm happy to report that month over month, from June to July, we saw a decrease from 18% to 11.2%. A lot of that has been through coordination and communication. We have our pharmacists making post-discharge phone calls. 2 pharmacy students on rotation are reaching out to patients after discharge. We have our charge nurses and our transition of care nurses actively using Tiger Text now to coordinate medication prior to discharge, as well as following up with patients and clinicians post-discharge. And they've now added 2 transition nurses to start looking at COPD and asthma, and are a little bit more downstream looking at renal failure, hematology, oncology diagnoses, and CT surgery in the near future. Next slide. So case mix index, we'll have 2 slides on this. The first is our medical case mix. So it's essentially unchanged from June to July, 1.24 to 1.25. We remain at goal and just below stretch. We do see that bump in January that was related to COVID. It's about a 20% increase in CMI with COVID patients, and it came back down as we saw a decrease in COVID cases. Our CC and MCC, so comorbid condition and major comorbid condition capture rates for DRG are at predicted goal, and from June to July increased slightly from 65 to 66%. Next slide. So this is our surgical case mix. It's stable, June to July, 2.96, again 2.96 month over month, remains just below goal. The capture rate did increase from 64 to 67 for CC and MCC. And the clinical documentation team is targeting specific service lines, trauma, ICU, and cardiology specifically. They're working through physician education as it pertains to documentation improvement. Next slide. Our patient experience. So this is top box, recommend the hospital. HCAHPS for Stroger specifically. The likelihood to recommend from August to September increased from 71.5 to 71.9%, which is achieving targets. Ling Dang is leading the efforts to implement standards of behavior, as well as bringing online on-the-spot recognition and service recovery programs for our staff. And next slide. This is our ambulatory measure. So HEDIS and ACHN, this is our A1C control. So percent of patients with an A1C greater than 9%. So we're measuring in-care patients right now, which we define as 2 clinic visits within 2 years. And we're looking at the percent of patients who have an uncontrolled A1C. So lower is better in this case. And we've seen, again, a decrease. It's been a very steady decrease since February. So we're down to 24.5%. Which is a full 4.2% reduction from the high in February. And we're zeroing in on that goal of 24%, which will represent top decile performance. And I think our last slide is just the definitions.
Great.
Take any questions?
I see a Mike.
Yeah, less a
Dr. Petey?
question and more a comment that this kind of trend on the that we see on the AHA1C is really gratifying, because this looks like a real trend, not a okay, I can explain this month and then I can explain next month and I can explain this month. You've got 6 straight months here, 7 months of a consistent trend. So something has changed. Keep it up.
That's all attributed to Dr. Irons and our ACHN team. So fabulous job there.
That's great. Director Harrington. Maybe not. Director Harrington, did you have your hand up?
Yeah, he's on mute.
Yeah, I took myself off mute. I apologize. Yeah, there's been an increase nationally, locally in RSV infections, and I was wondering if that's had any impact on us.
It has in general. We've had some discussions with the ED with pediatric holds. There is a plan in place between staffing and opening an additional unit that we're calling 4,800. It should add a handful of extra pediatric beds to help handle the issue. It has been, to your point, very global. We have had these patients holding because the other hospitals in the area also can't accept their full as well as their PICUs and their PEDS units are full.
Thank you.
I don't think I see any other hands up. Thank you, Dr.
Thank you.
Heiss.
Thank you.
I'm going to turn the floor over now to Leslie Frame, the Associate Chief Quality Officer, to give us regulatory and accreditation updates.
And Madam Chair, before Leslie begins, I just wanted to state for the record that Director Garza is with us.
Great, thank you.
Great. Good morning. Here are regulatory updates. I've been basically giving you most of the same updates. We don't have any survey follow-ups. I highlighted actually what's new from the prior month. We are still waiting for our stroke certification. This is a survey that we actually get notified of what the date is. We do expect it before the end of the year, and we do have our second mock scheduled for the November 28th of this month with our consultants. The next thing that is new regarding Provident and our inpatient dialysis, our first inpatient dialysis started on October 11th. We are required to report that to the Joint Commission within 30 days of the first service. So I did do that on November 10th, and then we are expecting an extension survey for that service line within 6 months. The other listed on here, nothing changed since last month. We're still waiting on these other extension surveys. Any questions?
Okay, thank you, Leslie.
Welcome.
The next, I'm seeing something else. Okay, the next action item on that, and we're now going to go to the action item component of our agenda. The first discussion is going to be led by Dr. Kumaplay, and this is to approve appointments and reappointments of Stroger Hospital Department and Division Chairs. There are 2 being presented today. So I'm going to turn it over to Dr. Kumaplay.
Good morning. Chair Kim
Good
and
morning.
directors. I'm respectfully requesting approval of the initial appointment of Dr. Priscilla Augustine as the chair of the Department of Correctional Health for an initial 2-year term, November 17, 2022 to November 17, 2024. Dr. Augustine did her residency training in Cook County. She came in here in 2013 and joined our faculty as a family medicine attending physician. She served on several committees and has held progressive leadership positions. In our time of need in March 2022, when Dr. Connie Malila resigned, the long-serving chair of our CEMAC health system resigned, Dr. Augustine was named as the interim chair. During the 11-month stint, she has done an incredible job of leadership, and I'm pleased that she has been confirmed and named as in the permanent position. I would like to also take this opportunity to thank Manny, the CEO of CEMAC, for guiding Priscilla in her role. So Priscilla has done a phenomenal job, and she was selected after a national search. The second presentation, I'm respectfully requesting approval of the initial appointment of Dr. Ayman Tulemat as the chair of the Division of Pulmonary and Critical Care Medicine of the John Stroger Hospital for an initial 2-year term, November 17, 2022 to November 17, 2024. Dr. Tulemat came to Cook County Hospital Cook County Health in 2002 as a pulmonary medicine, critical care medicine specialist, and subsequently also gained specialization in sleep medicine. He's held several leadership roles in Cook County and has also served on several committees. Since June 2021, Dr. Tulemat has served as the interim chair of the Division of Pulmonary and Critical Care Medicine. He was instrumental in leading us in our COVID resurgence with regard to the critical care staff, and also instrumental in our opening of the Provident ICU. Dr. Tulemat was also selected after a national search, and I'm proud to present him to the board. Thank you.
Thank you. Thank you for those presentations. Any questions before we move on to the next item? We will hold our for combined motion at the end of the meeting. Next, we are going to be having our EMS and MEC reports. The first to present is Dr. Akintoran. He's going to present on the Stroger Hospital medical staff action items for our consideration. Dr. Akintoran.
Unfortunately, Dr. Akintoran is not available, so Dr. Kumapule will be presenting the reports on his behalf. So yeah, the first is a report of the Credentialing Committee of the Executive Medical Staff as approved at the EMS committee meeting on November 8th. This is a report of the medical staff appointments, reappointments, and changes for your consideration. I believe you have a copy of that report before each of you. Please let me know if there are any questions.
Thank you.
I will now present thank you. I will now present the summary report of the Stroger Hospital HQIPS committee based on the meeting of that committee on September 27. The minutes have been submitted to and accepted at the November 8th EMS committee meeting. Here are the highlights. With regard to stroke, the stroke program compliance with antithrombolytics by day 2 was 100% for July. And we also achieved 100% for stroke patients who were discharged on the statin, and for stroke patients who had been accessed for rehab prior to their discharge. With regards to infection control, the surgical site infections have been doing well, and the standardized infection ratio for 2022 year to date is 0.7. Anything below 1 is great. The SIR for CDIF is also very good for the period of January 22 to July 2022 at 0.62. and we've not had any multi-drug resistant organisms reported so far in 2022. With regard to the HRO died presentation, the HEDIS HRO group gave a presentation. Breast cancer screening, 66% of women aged 50 to 75 were screened within the last year, which is at the 75th percentile. The first quarter performance was at 51.8%, and the second quarter was 52.4%. So this is a significant improvement. Childhood immunizations are up to the 75th percentile. When you look at quarter to quarter, the numbers have gone up from 59.5 to 66%. With regard to hypertension screening, we are at the 75th percentile. For the first quarter of 2022, we were at 48%, and for the second quarter, we are at 53%. And we are exceeding our goal of 63%. There were no action items for the EMS committee, and there are no action items for the QPS committee today. Are there any questions?
Director Harrington?
Yes, I have a question in terms of the hypertension screening. I know that every patient who comes get a blood pressure check. So what is the difference between hypertension screening and people just getting their blood pressure checked when they come for a visit, routine visit? Every routine visit requires a blood pressure.
I'm not sure what specifically they are measuring with this, but we will get an answer back. I will contact Dr. Sharon Irons, who leads this group.
This is
Director Pendergast?
Prendergast. Yes, typically they look at percent controlled, so meaning less than 140 over 9. I think they're looking at control. At least that's typically what we measure with this. And I'm not sure what they have said as the cutoff, but typically that's what we look at across.
So we're talking about blood pressure control, not blood pressure screening.
Correct. That is the similar to what we do with the A1C, right? It's just the
Right.
amount, but the fact that it's being done and the percent of blood pressure that is actually controlled.
Correct.
Okay.
It's those below 140 over 190, or 140 over 90.
Yeah, that's what. Okay, I just wanted to make sure that we were all using the same. But yes, that's typically what we use for that measure.
But is it? But still, is it screening or is it control? That's what I'm trying. I'm talking about the terminology.
Yeah. So yeah, no, but I think when they're saying hypertension screening is the fact that we're assessing this, right? So so it's not really screening, but more screening for determining what percentage is controlled, if that makes sense.
Okay.
Dr. Kumple, maybe we can follow up with this and understand a little bit more about this specific metric to make sure that is how this is being defined.
Sure.
Thank you.
I don't see any other questions. I'm going to move on then. Thank you, Dr. Kumple. Dr. Mark Loafman is going to present the Provident Hospital Medical Staff action items on behalf of Dr. Marlon Kirby, the president of MEC, for the committee's consideration. He'll also present the Provident Hospital Quality Committee summary for our information. Dr. Loafman.
Yeah, thank you. Good morning, directors and staff. It's nice to be here and in clinic. So that's my backdrop here, but we've got a nice little break and I'm able to join you this morning. So EMS report is in your file. As you see, there's some of the highlights were in terms of health information management. Look at really good, successful completion of op reports over here on the timelines going back and through the summer. So we're happy with the staff being able to keep up with that, and a little good surveillance and good medical staff coaching on that has been helpful. The H&B compliance, history and physical, it's the timing of having it completed that meets the standard. They all end up getting done, but it's are they done in the timely manner? And we're at about 86%. Strive to be better, but it is a tight timeline, and so that's continues to be a goal, but with good progress. Discharge summary similar. Needs to be done in a timely manner. They always get done eventually, but need to be done in a timely manner. And we were at 100%. So I think op report and discharge summary really good. H&P is close to goal with improvement noted. Some of the patient safety highlights were really just looking at event reporting, and with the increase in activity in 2022, a significant increase in activity. We'll hear clinical activity in the inpatient side. One might expect more event reporting. There was actually less August compared to July, just in the month to month. Based on review, it was feeling like it wasn't that anybody wasn't reporting. It's that there were good mechanisms to problem solve and deal. So we think that's a favorable trend, but we'll keep an eye on that as well. The staff did look at contract surveillance. There are obviously lots of large contracts here now, lots acting in. There was 100% compliance on the contract and control for that. Yeah, the credentialing committee report, there's lots of credentialing going on in terms of active staff and bringing temporary staff on for some of the emergency programs. So the credentials committee report is included. And then our quality summary, we continue to see nearly 100% on hand washing compliance with lots of good monitoring on that. There's been no falls on our inpatient side. Several highlighted areas. The ER continues to look at average length of stay and left without being seen. We haven't seen much more improvement, but we also haven't seen it got worse given the increased activity that's happening. So there was talk about the need to get the fast track area open. It's the lower acuity patients that tend to leave without being seen. They're not particularly sick. They're there for a minor problem, and they're less patient, obviously, to stay. So the ability to separate that group out and see them in a little more rapid cycle is there. The system is there. It's just staffing and running that. So there was good discussion about that. That really completes the report. I'm happy to answer any questions. Lots of good activity going on here at Provident, and we continue to grow, and there's general appreciation for all the support from the board to be able to help do things that we're doing here at Providence. So thank you.
Thank you. Any questions? I don't see any hands raised. Thank you again for these reports.
Yes, happy to do it.
The next item on the agenda is the quality and patient safety minutes. These were approved by the board at the October meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes? Okay. I'd like to entertain the following combined motion to approve the following. Approve item 4A, proposed Stroger Hospital Department Chair and Division Chair initial appointments. Approve item 4B, Stroger Hospital medical staff appointments, reappointments, and changes. Approve item 4B, Provident Hospital medical staff appointments, reappointments, and changes. And accept item 4C, the October 21st, CPS committee meeting minutes.
I'll make a motion.
Second.
Thank you. The combined motion's been made and seconded. Madam Secretary, please take the roll call vote on the combined motion.
Roll call vote on the combined motion. Aye or nay, Director Garza?
Aye.
Director Prendergast?
Aye.
Director Story? Director Story? You may have stepped away. Chair Kim?
Aye.
And circling back to Director Story, are you present? Oh, Director Story, it's the roll call on the combined motion.
Debbie, I'm present and confirmed. Yay.
Yay. Thank you very much. Madam Chair, you have 4 yays and 0 nays.
So the ayes have it and the combined motion carries. Thank you. The committee will now be going into closed session. Action is not anticipated to be taken in the open session after the closed meeting has adjourned. I'd like to entertain a motion to go into closed meeting pursuant to the following exceptions to the Open Meetings Act, 5 ILCS 120-2 C 1, 11, 12, and 17.
So moved.
Seconded.
The motion has been made and seconded. Madam Secretary, please take the roll call vote for the motion.
Roll call vote on the motion to go into closed session. Aye or nay, Director Garza,
Aye.
Director Prendergast,
Aye.
Director Story,
Aye.
and Chair Kim.
Aye.
You have 4 yeas and 0 nays.
The ayes have it and the motion carries. I think at this point, we will go into closed session. So thank you.